So my name is Ricky Choi. I'm the head of digital health at Samsung Electronics America. And my office is based out in Mountain View, California, but we have offices throughout the United States. As an aside, I'm also a physician. I'm a part-time practicing clinician as faculty at Stanford.
Excellent. Thank you, Dr. Choi. And so Samsung, I think of phones, I think of electronics, I think of consumer devices. I do know healthcare, but for those that aren't familiar with Samsung's role within the healthcare ecosystem, give me a snapshot.
Well, I think it's helpful to start from where we started from in our current positioning. And so, as you know, Samsung is one of the largest consumer technology companies in the world. We have tremendous penetration and really broad reach. For example, in the United States, 70% of American homes have Samsung technology in it. So we're talking about televisions. We're talking about appliances like refrigerators and stoves, as well as IoT, and of course our smartphones and our wearables, rings and watches and earbuds. And so, over the years, we have been building out our service capabilities, trying to figure out how do we connect those dots, right? Think about those as touch points, understand user needs, help drive them to help them achieve their health goals, tie them into care as they need it. Also, we're continuing to evolve our wearables to sense new things that typically or ordinarily only sense within the four walls of the hospital. And also, we have part of our business is also focusing on providing some of those technologies for hospitals and health systems.
Yeah. And as I'm aware of too, it's not just all of the stuff happening outside of the hospitals. They're also involved in the hospital side itself. Tell me a little bit more about that.
I'm sorry, say that one.
Oh, so it's also in the smart hospitals of the future, the Samsung hospital, like your involvement directly within the hospital space too. Tell me more about how that all fits in.
Yeah, so we have, pilots that we're working on within Korea, the Samsung Medical Center, which is one of the premier medical centers in Asia. Again, American context here, but if, for example, the President of the United States were to get injured, then he would end up going to that hospital. And so looking to figure out how do we help ease workflow and help improve the patient experience and outcomes. But also we're thinking a lot about in the future where we imagine care to shift increasingly to the home, where we already have that broad positioning and help people, improve their health based at home. And I think that's kind of something that we've learned, we kind of knew, but during COVID, we all did that exercise, right? From home, trying to manage our health, discovering we get sick there, trying to figure out what do we do about it, sometimes having a hard time seeing a clinician when you really need it. And so trying to empower our users or patients, depending on the situation, so they can manage their care on their own.
Yeah. And back to the wearables for a second, or consumers having more information in relation to their own healthcare, because I feel like perhaps a few years ago that the kind of person that would monitor, vitals or information that's come off any kind of wearable device is someone who's already quite actively involved in their healthcare, perhaps looking at optimization or perhaps have a specific reason that they're doing that, need to be quite educated, informed and literate to be able to do that. Increasingly, I'm seeing, there's a lot of stuff happening behind the scenes. I think you alluded to it earlier as well, that them providing indications. Talk me through how that journey a little bit more about that evolution of the wearables from a consumer side and what that might mean for the future for us as well.
Absolutely. And I think there are a couple different angles to think about it. The first thing is that we've I've gone much further than just counting steps, which is where a lot of the wearables started.
Yeah.
Right. And there's value in that in and of itself. But now we're doing things like, Samsung has cleared 3 features under an FDA designation called software as a medical device. So they've achieved a certain threshold, a clinical threshold, around detecting moderate to severe sleep apnea, around single lead EKG, as well as irregular heart rhythm notification. It's kind of a mouthful. Yes. And so those are examples of things that typically would only collect, within the 4 walls of the hospital. And there's a whole roadmap of other things that we'll be collecting going forward. So we imagine that kind of data is going to help people receive early warnings, alerts around potential health conditions they may have or they may develop over time. And so they come informed when they're engaging with their clinician. We're seeing changes in form factors, right? It used to be the smartwatch or the band, and now we have a smart ring that we launched a few months ago. Earbuds, that will in the future, There are companies that are building out hearing aids and et cetera. So I think that's really exciting. And maybe just one last point is that while maybe 15 years ago when all this started, maybe 20 years ago, I guess, when that first started coming out, it was kind of considered kind of an edge where only certain types of the vanguard, the cutting edge folks would use it. But if you think about it, the people who had the disposable income at that time are in their 60s now, right? And so that we're definitely seeing demographically the adoption of these technologies certainly growing in older populations.
Yeah. And I guess on the other side too, building on that point, from a clinician's point of view, that 15, 20 years ago, if you're a patient, you walked in, you showed your doctor your wearable and said, I've got this, they might be polite and put it to the side or would be more direct with you about how that's not good data. You talked about software as a medical device. You talked about regulation. You talked about like bringing things in. How well adopted do you think or accepted some of these technologies are within the system?
Yeah, I think, as a physician, for me, I'm pretty flexible about what patients like to use because one of the primary goals for me is engagement. If that helps people be more mindful about their health, I'm open to a lot of different things. And so I think that kind of mindset is growing. So I think that there is something about engagement, helping people do the healthier thing, be reminded and be aware of their health conditions and achieving their health goals. And of course, second is around accuracy of that data. And I think that we're finding that's becoming ever more accurate. Now, if you ask any clinician, no one wants streams and streams of data of every 2 seconds of their heart rate, right? But the goal or the value will be around the trends over time. And so I think that the technology companies are getting better at not just serving the raw data, but thinking about how do we apply analytics and also think about what's that next best action that people should be taking. And so I think that we'll find the technology companies continue to evolve in that way. And the users or the consumers find increasing value. And correspondingly, the physicians will start to say, oh, okay, I see where there's value here as well.
Yeah, I like it. And so lastly, you're up on stage at some point here at Health. Will you be sharing some of those insights that we've just talked about then? Tell me a little bit more about what you share.
Yeah, absolutely. So I have a short little announcement blip where we'll be talking about, our ongoing journey to tie in wellness fitness into increasingly adding value on a clinical and healthcare perspective around personal health records, around medication reminders, as well as a share and care feature that we're adding to the Samsung Health application, an application that has about 70 million monthly active users globally. And we're also going to be on stage for a panel called the Future Feature of Health, thinking 15 years ahead, right? So then we're talking 2040, what does healthcare look like at that time? And we'll have on stage, hospital administrators, leading people in technology, and leaders in public health to think through what that means and specifically how digital health or digital technologies will help us get there, tie into where we see the future today. And then maybe as a third topic item will be around what are the barriers that need to be removed or changed for us to really get to that future where we're really improving health.